Doja Cat has been in the news and people are talking about her breast augmentation, and she has a somewhat common complication called capsular contracture. What is that? Well, that is when your body actually forms some scar tissue around the implant, and there can be a couple reasons for it. There can be an infection, there can be a small amount of bleeding around the implant, but sometimes we don't know why it happens. It kind of happens. And the treatment, relatively straightforward. Take the implant out, take the scar tissue out, and replace the implant. Let's talk about ways we can avoid capsular contracture. Number one is good surgical technique. And so minimal blood in the pocket when we put the implant in, use of antibiotics, minimal touch techniques, so we're not handling the implant or letting other people handle the implant before we put it in. Also, putting the implant underneath the muscle. Even though people are kind of advocating over the muscle implants, putting the implant underneath the muscle is still a very, very effective way at lowering your risk of capsular contracture. When we're thinking about capsular contracture risk, what's your overall risk for it? If you look at nationwide studies, it's about 7 to 8% over your lifetime. At our practice, we're really, really lucky. We pay a lot of attention to our data. We're at about 2 to 3%. And so we're working really, really hard to make this a wonderful operation for people that doesn't have issues or complications that you may have to deal with in the future. And we're really, really happy that we have such a low number. So there's gonna be a lot of other questions about capsular contracture. Put them in the comments. I'm happy to answer them.